Hey, what's up YouTube? What's going on? Just a quick little video here. And I've been getting a lot of questions recently about traction and just my thoughts regarding devices such as an inversion table or other traction devices or other forms of traction, specifically on the spine. So one thing to understand, guys, is that when you traction the spine, so we'll use our little model here, but you're pulling the joints apart and the disc space apart, so everything's being pulled apart. So the benefits of doing this for some people is that it may provide relief to people who may have some form of stenosis or maybe a disc herniation is impinging on a nerve root, and we can maybe create some space for relief, and it may take pressure off our nerve root and we may get some temporary relief from doing traction. Now on the flip side though, why people may experience pain is that when you pull things apart, if you have some degenerative issues maybe on, let's say, the facet joints here, and you pull everything apart, you've now opened everything up and destabilized things. So when you destabilize things and then you go to an activity where you need stabilization, such as maybe walking, so that would maybe be getting off an inversion table, you go back to a form where you need stability. And so when you pull those joints apart now when they go back into place and kind of compress, they may not fit properly together as they once did prior to maybe going on something like an inversion table, and that could trigger some sort of pain response because the joints maybe aren't moving smoothly, or there's some sort of maybe micro movements that are taking place when you go back to a compressive activity that requires stability. So the point that I'm trying to make here is with any form of traction, you're creating less stability. But when you compress things, you actually create stability and things become more stiff. So that's why you need to be very careful with doing traction, and not every joint or area should be tractioned or destabilized, because that could possibly trigger a pain response for someone that may have some degenerative issues. And then once you go back to an activity that requires stabilization, you may not get a stiff, or you may not have the support to stabilize that area, and that could trigger a pain response. So that's just a quick thought on traction. And I'll admit, I was guilty of doing a lot of traction years ago for the purpose of increasing mobility, and I thought it was always just a good thing to traction joints and whatnot. But once you understand things and kind of break it down, and once you actually go through a bad experience where you have a pain response, you start to understand the mechanics of what's actually going on and why things shouldn't always be destabilized or tractioned, and things actually may be better stiff. So that's just a note that I wanted to mention. And the thing is, when you're doing any form of traction, you need to be careful. And that means using an inversion table. Maybe you're pushing up on a chair and raising your feet in the air, or maybe you're hanging from a pull-up bar. Whatever form of traction you're doing, you need to be very careful, because whenever you're destabilizing joints, if you don't know what's going on in your low back and what's causing your low back pain, you could make it worse. So something just to consider and think about, because not everyone is going to respond well to traction. Actually, some people may get worse with it. But for the people that do get better, it's usually because you're creating some sort of space, that maybe you're taking some pressure off a nerve root and providing some temporary relief. But for someone that has some instability issues, some degenerative issues, when you destabilize things and then you put things back into place, they might not go back into place smoothly, and that's what could create maybe some sort of pain response. So just a little quick note, I wanted to make the video because I've been getting a lot of questions lately just about traction and different forms of traction. And I'll just mention one more thing. When it comes to traction, usually I recommend people try, if they're looking to get into traction and maybe try it out for maybe back pain relief, to either maybe try an inversion table out before purchasing one, or try a different form of traction that may be less impactful. Maybe that's hanging from a pull-up bar, maybe that's pushing up on a dip bar, or pushing up on a chair, or something related that still creates traction. And if you respond well, that may be a good sign that traction would be beneficial for you. But if you don't respond well, then there's your indication that it would not be good for you. But overall, just be very careful with it and just keep that into consideration. Anyways, wanted to share that with you guys. Hopefully this helps a few of you guys out there who may be unsure about doing traction or not. And the key thing to understand is that traction is going to destabilize things and it's going to open things up, whereas when you don't traction things and actually create compression, you're creating more stability. So it really depends on the individual and what their goals are when doing traction. But anyways, that being said, if you have any questions, comments, leave them below and we'll wrap up this video. Okay guys, all the best and take care.